everybody. Hello, good day. Sorry for being a moment late. Just on the next door on the left side, I'm just listening to former President of Finland, Tanya Halonen, and Gordon Brown, and Jeffrey Sachs, a little event that I've been taking part in. Why is there stuff happening like that this week? Well, it's the General Assembly of the United Nations, a quite unusual General Assembly, the first time ever in 75 years that the General Assembly has taken place virtually. Apparently, leaders are having their videos projected in that General Assembly Hall in New York. There's nobody there because it's virtual. So anyway, I've just turned off the presentation there because although it was really interesting to hear how some of these leaders are angling things, what I'm actually going to do is to develop my short narrative today, actually based on a debate that's going on in several European countries right now. What is the right strategy for dealing with COVID as it returns into Europe and into other parts of the world where they've got their numbers down? What's the right strategy? And I'm just previewing what I'm going to do. I'm going to focus on the two different positions in the UK, some that are supporting the Chief Medical Officer, Chris Whitty, and the Chief Scientific Officer, Patrick Vallance, and another group, Professor Gupta from Oxford, Carol Sikora from nearby, saying, actually, no, a different strategy is needed. And in my own position, is actually, for a change, picked up in a newspaper. It's in the British Daily Telegraph. And I want to tell you a bit about how that article came to be written and also talk about it. Now, many of you are stuck in the middle of these debates about what's going on. Many of you are wondering which is the right pathway to follow. You're either in countries where COVID is still quite active, or you're in settings where the numbers have come down, but it's picking up again. And I want to have a good discussion about this because I actually think that we can find a pathway. And it links, of course, to what we've said in previous briefings, but I'm going to really go specific today. Let me, as we're starting off, tell you a little bit about who's joining our meeting today. Well, we're going to have Chris Shipton joining as illustrator. He's doing something else right now. I hope he'll join in about half an hour. We've got Loy Rago on. Thank you, Loy, for being with us, and thank you for all your initiative on networking us. Marianne Hasselgrave, thank you for sending me some really interesting emails about where you think things are going to go in a number of different areas, and please keep in touch. Joe Nichols, and I think Miles and Zara might be there. I can see Zara, I can see hello and welcome. Jonathan, thank you for joining again. Jonathan Fluxman, we had a discussion last time on airborne transmission. Super interesting to see where that's going. Louisa Nofke, thank you for joining us. Lovely to see you again. Rebecca Cantor, lovely. Yosef Gottlieb again. I look forward to going back into some of the stories from Israel if you want. Annie Feltham, thank you for the exchanges that we had, particularly with you and Holly after the last briefing we had. And I think Holly is not on today because she's involved in a particular session, and so she asked to send her apologies. Karen Wiedenmeyer, thank you for joining us. Leah Marie Lucas, lovely to see you. Will Ramsey, excellent. Godfrey Philemon, thank you for joining from Tanzania. Veronica Quintana and your husband, thank you for joining from Cancun. I'm just in a big discussion with our friend Eva Gurrier at the moment about something. She sent you her best wishes. Paul Garner, thank you for being with us and for your absolutely amazing work. I hope you are keeping strong with long COVID, and I've been talking about long COVID a lot over the last few days, and you'll hear why in a minute. Kathy Matthews, thank you for joining again. Hank, it's lovely to see you here. Joyful that you're with us. Georgina, great that you're here. Iman, super that you're back. Kirsten Hawkins, thank you for being here. And then also Hart Janssen, nice to see you. And Terry Jackson, great. Sarah Phillips, so glad that you've managed to join us again. Carl Taylor as well. Rojan Dahal has been writing to me some fascinating stuff about what's happening in Nepal, particularly really acute hands-on accounts of how poverty is deepening in the country. And I've just been talking with colleagues from the US who are particularly somebody called Jean Baderschneider. Rohan, you wrote to me about modern slavery and the fact that people are selling their children because they're having real difficulty with the financial complications of COVID in South Asia. So I had an exchange with Jean Baderschneider, who works for the Modern Slavery Fund. I didn't mention your name, but I quoted what you told me just now. And she said they are super aware of the increase in modern slavery in South Asia that's happening as a result of COVID, and they're active on it. And so I'm very glad I was able to connect. Thank you very much indeed. Lily McGow, thank you. Welcome to our meeting. And then I see also RBS, hello and welcome. If I haven't mentioned your name, forgive me, but I wanted to greet everybody because we are a network. We are a group that is united by wanting to work together on these issues. As our conversations progress, so the issues we discuss become more and more vivid. We're also applying in our own work some of the things we're discussing here. I certainly am. And that's one of the reasons why I wanted to talk to you today in a very direct way. Let me just quickly go to our colleague Twee. Twee Nguyen is here. Twee, could you start us off and help us with just the survey and any other observations you've got? Twee.
Thank you, David. So as I do every time, I like to find out where you're all joining us from. So I've launched a poll. You will have the pop-up window on your screen now with the first question. Please share where you're joining us from. Once you've selected that, you can scroll down and select your age range. And then for the last question is how you're feeling today. It is a multiple choice, so you can select more than one answer. And it's our way of feeling the mood of the room despite being a virtual meeting. I'm going to leave that poll open and I'll pass you back to David, and we'll come back with the results later in the session.
Twee, I'm so sorry, I didn't mute my mic while you were doing that. I was just doing a quick exchange with our stage manager here, Catherine Deland, our senior health advisor. Did I cut you off, Twee, or did you manage to get your words across?
No, very happy, all yours.
Thank you very much indeed. Just a word about Twee. What she's doing, as well as doing surveys and things like that, she's connecting us. And that's because she is passionate about connection. She's also passionate about information. And she's doing a lot of work now on trying to make sure that we are able to share what we consider to be verified and useful information, and that we're doing whatever we possibly can to tackle misinformation. It's what the WHO calls infodemiology. Sorry, is that right? Infodemiology. And so tomorrow we're doing a session with WHO on conspiracy theories. And I've taken a particular line on this. I'm saying, you know, we have to recognize, and I hope you agree with this, Twee, that some of what's happening at the moment is quite horrendous. It's really difficult for people to get their heads around. How can a virus come along and cause such a lot of distress and suffering, particularly for poor people? How can it cause such a lot of misery, especially for women, particularly women who are running single-headed households? How can this happen? You know, what has humanity done wrong? And, you know, perhaps some years ago, we would have depended on religion to help us explain this, and perhaps we don't do that so much now. But we've got other ways of perhaps explaining And that's when we start to find individuals or processes or institutions to blame. And then we can get into quite intense conspiracy theories that, of course, say, well, vaccines are coming along to inject microchips into you, or there are people who are actually pushing this virus around because it's going to give them markets for their vaccines. And it builds up and it builds up and it builds up. And I'll bet you everyone here has at some time or other thought, well, perhaps there is some weird conspiracy going on that I don't know anything about. And what Twee is doing is she's helping us to actually work this through. And she's helping me particularly to identify a certain kind of journalist who just occasionally tries to pin stories and make them bad, and we've had to deal with that. But also to find people who are using social media. Twee, do you want to say anything about your own views about all this and why it matters so much that we do everything we can to share what really matters to us and what, as far as we know, is the best reflection of the truth about this virus and what it's doing to humanity?
One thing I'd just say, and I liked from your previous speech at the last Infodemic conference, is that is for us to find a way to understand where people are coming from. They're scared, they're looking for answers, and sometimes the answers aren't very easy to find. So it's for us here in our network to find out that verified information and to deliver it to people around us in a way that appreciates what they might believe, where they're coming from, and not in a very kind way. I think it's very important to do it kindly. But that's something I've learned from you, David. So back to you.
Haven't always been like that. There are people here on this Zoom who know me for a few decades, and I think I've calmed a bit with the years. But I am interested in understanding where people come from. The more media work I do, the more I find that even when I'm really telling the truth as I understand it and trying to connect with people while I'm talking to them, I still get some of the most extraordinarily foul remarks coming back. And then I think, well, yeah, but that's saying more about them than about me. And it's telling me about their challenges they're having with coping with the situation. And then sometimes I connect with the people. I've got one person who wrote to me just a short message after a thing I did with the UK Foreign Affairs Committee. And he just wrote, "You're so boring." So I said, well, COVID's not fun. And then we got into a little banter. And he's actually started writing me some really interesting stuff about just how difficult it is for people, particularly in small businesses, who felt that their businesses were picking up again in June, July in the Northern Hemisphere. And then suddenly they're now got this new spectre of more trouble, and they don't know how long it's going to go on for. And gosh, they're feeling awfully, awfully upset. So I think you know, we just got to be, I think, recognizing that some people do have to find an individual or an institution to blame. So Twee, thank you. And actually, I have to say I've learned an enormous amount from you on this, and perhaps that's what helps us all, is we're learning from each other. Let's go to Paul Garner for a second, because Paul, I'd like just to give you, I'm going to ask you to just judge this. You know, yesterday, the Chief Medical Officer of UK and the Chief Scientific Officer did an illustrated presentation, just reminding everybody that this virus increases in amplitude exponentially. And they reminded also that currently in the UK, it's doubling overall every 6 or 7 days. In some parts of the UK, it's doubling more quickly. And you and I, Paul, know that there were times in March when it was doubling every 3 days. So you've got the Valence-Whitty position is the government probably has to tighten restrictions on people's interactions. And today in Scotland, the Chief Minister has said that she's sufficiently worried she's actually stopping people from visiting each other in their homes. I mean, really strong. And they're saying, we got to get the numbers down, and we'll do it by reducing contact between people. And then you've got this other group, led by Gupta, epidemiologist in Oxford, Sikora, who's a cancer specialist. They're saying, no, you've got it all wrong. Isolate the over 65s. Basically, ask them to self-protect and almost mothball them, and then let the virus just move as it wants to among younger age groups. And then over time, there will be widespread antibody build-up in society. This is their, I mean, it's not my position, it's their position. And you will get this thing called herd immunity, and then society can go on. So you've really got these two positions. And my own effort to contribute to this with a journalist from the Daily Telegraph who kindly rang me about it yesterday was I said, you know, I don't believe in locking down and very draconian restrictions. But also I don't believe in just letting the virus go. And Paul, I quote you, of course, but I'm asking you to react to this. Because I say, you know, this virus isn't trivial, it's dangerous, it's cunning, it's nasty. So let's recognize that. And instead I say there's a middle path, which is getting ahead of the virus by two pathways. One is people taking it on and changing their behavior, masking, physical distancing, hygiene, and basically protecting those who are most at risk, and working very carefully in high risk transmission situations to reduce the risk, such as very confined spaces where people live, or such as all the things that are happening in big factories, and particularly meat factories. And then I say, and the government's got a role. It's obviously testing, because you've got to know where the virus is. It's also isolation. You've got to help people to isolate, not penalize them for isolating. And it's contact tracing. Because actually, I think all the evidence is when your numbers are low, get your contact tracing right. And I've said the middle path then is that we learn to defend ourselves against the virus. And I think, obviously, the position that I hold, it's the WHO position. We really want to encourage people to move away from locking down, taking the power away from people. We absolutely don't want this mothballing of the old and letting the virus roam. And we think that a different social contract between the state and the individual with lots of local level action is the way to go. Paul, how do you react to this debate? You must have seen it in the UK papers this morning.
Yeah, I mean, the policies are insufficiently nuanced. They are insufficiently informed by local evidence and local responsiveness and local responsibility. So I absolutely agree there's a middle way that is about high risk situations, identifying them, closing them down, dealing with them, and then when transmission has occurred, detecting it quickly, closing it down rapidly, responding rapidly in local situations. It's all too massive. It's either on or it's off at the moment. And the quicker we get more sophisticated at looking at high risk situations, looking at areas where outbreaks are occurring and responding to them, and making the public aware to make their own decisions. You know, in Liverpool, everybody is saying that people are weary of rules and weary of rules that don't make any sense. And I spoke to an 80-year-old woman who said, I've had enough now. I'm going to wear my mask and I'm wearing my gloves. But, you know, so people are beginning to dismiss this whole series of rules that is not treating people like people. And the only other thing I would say is it's not about deaths, and it's about illness in young people as well. And I know a lot of doctors that were heavily exposed, and a 33-year-old boxer, anaesthetist, has not been able to work more than 200 yards, has just got a diagnosis of cardiac myomyositis from her GP. She's damaged for the next year from this disease at least. So it's serious in young people as well.
That is the key. So when these people are saying, well, just let it move through the population, it doesn't really have any lasting impact, we have to say, hang on a bit, what's your evidence? And Paul, this is why your work is so important, really is. I see, by the way, I mean, I hope you don't mind, I'm going to give a few shout outs. A colleague of mine called Sarah Bosley is on this call. And Sarah, if you want to talk, we are super interactive on these briefings. I tend to give some remarks at the beginning and then we reflect. And some of us have been coming on these discussions for several weeks. We've been traveling through this whole COVID and talking to each other about it twice a week. If you feel like making any observations, Sarah, you and I have worked on so many issues in the past, and I really, really would value your judgment.
Listening to Nabarro. It's got pizza. I was looking at the drive.
Okay, I just can hear somebody else. But Sarah, if you want to unmute yourself and speak, please do so. Any of you want to speak, please just leave a message in the chat. We'll bring you in. It'll be interactive. It'll be fun. And just today, we are focusing on this rather extreme position, and particularly those of you in very poor settings or who've worked in very poor settings. Just for some of you, this issue of do you just let go is also relevant, particularly where the mortality rate appears to be low and where the costs of containment are so high. And I'm very, very happy to continue the discussion. Is this notion of the middle path relevant to where Joe and Miles and Zara are in Kenya looking over the border into Somalia? Is it relevant where Rojan is in Kathmandu trying to deal with the appalling situation faced by the people of Nepal with a very, very high rate of transmission and extreme difficulty of working through how to reduce the transmission threat, and especially how to avoid lockdowns, which are so punishing for the Nepalese people. And then we've got colleagues from India as well, and we've got colleagues from Africa. And I might particularly want to give a big shout out to N.K. Sethi, who has written to me this extraordinary piece comparing what he is seeing in Bangladesh and in Pakistan and in parts of India. And really, really, NK, I value that so much. And, you know, we're talking all the time about nuance, but I do want to stress what Paul has said. As I work with leaders of city councils, for example, in the north of Britain or in Scotland or in France and Germany, I'm hearing more and more people saying to me, in the end, it boils down to the relationship between authorities and the people. Is there trust? Is there respect? Is there the possibility of a social contract? And, you know, when you look at the countries that seem to be doing the best, they are the countries where the relationship between people and authorities are built on trust and respect rather than based on rules and fines and imposition. So let's go around a bit and just, I'm just going to invite, let's just see, Sarah, what have you just written? I'm just looking at what you've written in the chat. Sarah, all I was just saying was, I was looking at what was happening in the UK with this slight positioning where you have on the one hand, the government and Chris Whitty and Patrick Vallance, supported particularly by Tricia Greenhalgh and others, saying, you know, we've got to take it super seriously and probably introduce more restrictions. Then you've got this other group that are saying, well, protect the older people, shield them, aged over 65, let the virus move through the rest of society. And then you've got David saying, actually, I'm not sure that either of these extremes is necessarily optimal. What really matters is the relationship between people and authorities and developing the capacity to get ahead of the virus, both by human behavior and also by the functioning of public health services, because in the end, that's what's going to matter, is whether we can put the defenses in place and keep the virus at bay for the foreseeable future, because we're not going to have any magic with the vaccine. It's going to take an awful long time to get the vaccine, when it is developed, out to everybody who needs it. and we still haven't got any vaccine through phase 3. So what I'm basically thinking is just offering any of you an opportunity, if you want to talk about these debates, to talk about experiences, particularly from local authorities and what they're doing, talk about experiences from businesses, or to just give your observations, and then I'll bring you in. So Sarah, that's how we work on these. And if you want to join, you're welcome anytime, given your own skills and experience of really studying an awful lot of different actors working on this issue. And as you know, I really value your judgment. Come in, Sarah, your reactions, please.
Hi, yes, I can hear you. Thank you, David. I think what's really troubling at the moment is the potential loss of confidence, actually, in what the government's saying, and even in what scientists are saying. And that rumpus, but there's two letters between the one group, advocating that that perhaps we shouldn't have general restrictions, but we should just somehow manage to safeguard the elderly and the vulnerable. And on the other hand, Tricia and co saying, no, hang on, no, we've got to take national measures where they're appropriate. I don't think this is helping public confidence. I actually think public confidence is taking a massive knock at the moment.
Yeah.
And for the first time, I've heard young people saying, we don't think this is fair on us, So there are all sorts of things in the mix here. And I do think that we've been probably all over the place with this. Our government has been saying, contradicting itself, has been seen to be not doing the right thing. They've been changing tack every 5 minutes. And that sort of behavior, as I say, is really punishing in terms of what the people believe and how willing they are to put up with hardship, actually, for the sake of the elderly generation and also the vulnerable people. So I'm really troubled by it.
Yeah. Sarah, my son Lucas has just gone to Bath today, actually. He starts university there. We had a long discussion over the weekend, and he said exactly what you just said. He said, it does feel really strange that I've lost the year that I was going to travel, what's called his gap year between being at school and university. And he said, I'm feeling very frustrated that my first year at university is going to be affected by this. I don't feel comfortable about it. And I think, that's just N=1, but I think in many parts of the world, there is a whole community of people who are finding that they are quite alienated because they don't quite understand the logic. Communication issues are huge. Sarah, if you don't mind me telling people what you do you mind me telling people what you do for work?
No, of course not. No.
Sarah is health editor of the Guardian newspaper in the UK. She actually did a lot of work on HIV/AIDS in Africa, and it's been particularly interesting on the relationship between authorities and people, and how the whole way in which health works can change completely if people are empowered to take a measure of control over their health action. And I've really enjoyed reading what you've managed to write about what's happening in the UK. And when I hear you say that you're seeing quite a big problem, big P problem, about loss of trust and loss of confidence, I quite understand it. As you look ahead, Sarah, do you think that there are signs that the UK will pull through this in a good way, or do you feel you're a little bit anxious about the coming 3 or 4 months, right through till Christmas?
No, I'm very anxious about it. I think, no, I'm really anxious about it. I think there's a loss of confidence in politicians and in scientists, and that's really a lethal combination. That's what we've seen, that's what gave rise to all the vaccine hesitancy, after all. I'm not saying this is in the same league. It's not that people think that there's some sort of conspiracy against them, but there is a growing tendency, I think, to distrust what they're being told. So is it really this bad? And when you have disputes over whether case numbers matter or whether you should just look at deaths and wait till you have high numbers of deaths, is that sort of angels dancing on the head of a pin that's troublesome. People are starting to think, who do I believe? And I really would love it if they would look to the WHO, for instance. If you know, Dr. Tedros could stand out there as the guiding figure, but he hasn't been portrayed as that in the UK, and it's been very much a political battle. And I find that even on my newspaper, that it's regarded as, you know, for me, it's the biggest health story ever, and because I write about health. But for a lot of other people, it's a political story. It's being actually covered in those terms. And that's troublesome too, because if it's a political story, then you have one side battling the other. Always. That's how politics works. So, yes, I'm very troubled about it, and I don't know where we're going. And we might end up having to have. We're talking now about the army taking on part of the role of the police, so the police are free to make sure that people self-isolate and such things. So all I can think is that we're going to have tougher and tougher restrictions and enforced restrictions, which isn't going to play well at all. You know, Britain isn't that country. They won't like that.
No. So, everybody, this sets the scene for a discussion that we're going to have for the next 25 minutes, as far as possible, if we can organise it this way, where I'm going to encourage all of you to reflect on the relationship between authorities and people. I mean, we've been here before, but I think it's so important. Trust is such a vital variable when you're dealing with infectious diseases. You're asking people to make massive changes to their behaviour, huge sacrifices, altering the way in which they live, altering the way in which they earn their living. And you're asking them to do this, not just for themselves, but for the broader good. As soon as you do that, as soon as you're asking people to act on behalf of others, you're really asking them to take a huge extra step on behalf of the wider good. And they have to feel really valued. So one of the things that happened as a result of our last discussion on this was that Holly Wheeler and John Atkinson, neither of whom can be with us here today because they're on a National Health Service senior training program, but they started a discussion. And in fact, it was really stimulated by Annie Feltham, who is here, on what are the steps that might be taken. Now, what Holly said was, we've got to find a way to really value, in a very public manner, people who are making sacrifices on behalf of others. So that instead of those who actually do this for the public good being labelled as do-gooders and wets and all that stuff, that actually we start to identify, perhaps with a logo on their masks, perhaps with a badge, perhaps with other ways in which there can be shout-outs. I mean, we've done this before, finding ways to value people who do extraordinary things. And they've said, now is a time once again to find a way to respect those who act for others. Let's think about it. Remember, we've been talking about campaigns. I noticed that Tedros is talking about doing it all. He did in his last speech. He's getting very focused on this, making sure you don't leave any stones unturned. But I think I want to go further. I want to find a way to actually draw attention to, in a very public manner, people who are actually saying, I'm doing this not just for me. I'm doing it for my family, for my society, for my community, for my nation, because that in the end is the way this is going to be turned, this COVID. It's a collective action. Chris Shipton, welcome. Thank you. Thank you very much indeed. Nice pictures starting up. Grateful to you for joining. Names coming up now of people I'm going to call on. I'll just tell you, and let's try to be quick. Not quite in the order they came in, but in the order I've got them in front of me. Leah Mary Lucas. If you'd like to do this quite briefly, give your point of view, tell us a bit where you've come from. I'd love to hear from you. If you could talk about relationships between people and authorities in different parts of the world, that would be great. Kathy Matthews, you're basically saying you're going to take us into a different area. We'll let you come in. NK Sethi, who's going to talk about the different pathways from the Indian perspective. Catherine Deland is going to take us, Rojan, into that area of how do poor people cope when they really are up against it. And that's something you've been talking about, and I want her to talk about it as well. and I will ask Twee to just butt in at some point and give us the result of the survey. Sarah, if you stay on, please feel free to interrupt at any time. You are our special guest for today, together with Paul Garner. I'm sure the two of you probably know each other, and so it'd be absolutely lovely even if you bat a few ideas around together. Leah Mary Lucas, would you like to come in now?
Yes, I'm happy to share a little bit of the different places in the world that I've been able to see the response. So I began, when COVID hit, I was based in northern Mozambique in the province of Cabo Delgado, where currently there are over 300,000 people displaced from their homes. So, coming from this setting where there's extreme food insecurity, where people are essentially not having, a home to live in, they're living in camps, they're living in crowded areas, they're living in tents and shacks. So what I saw from the level of response and protective measures, with the COVID crisis is actually they took COVID very seriously. And from the very beginning began to wear masks. From the very beginning, there were very strict, government down authority mentioning what can and cannot be permitted in terms of numbers of people congregating, etc. And this has all been informed from my perspective, from a scientific information, taking WHO guidelines, etc. Leaving Mozambique, I was several months in Switzerland, and there saw again, the very widespread use of masks, very serious sort of acceptance from at least the community where I was living in Geneva of the COVID crisis. And I've now come to the United States. I'm in the Midwest USA, and I think that coming from outside of the US and living outside of the US, it's difficult to understand, even as an American, it's difficult to understand some of the resistance to taking the crisis seriously. I'm in the state of Iowa, and this is where I'm originally from, so it's not as if this should be a surprise to me, but it has been very difficult and challenging to see that here the COVID crisis is not being taken seriously. The numbers continue to increase. There are no restrictions on large-scale gatherings of people. Masks are not being used. Using a mask is seen unfortunately, by many members of the population as something that is a weakness. It is, a fear. I'm afraid of COVID, so I'm using a mask. And I really agree with what Dr. Nabarro said about the idea of reframing, using a mask. And I feel like in the United States, in these rural areas, somehow using a mask needs to be seen as patriotic. And I feel like there is such a need for a campaign that can transform how people are seeing the use of a mask. And, it's not that much to ask for people to, maybe not have their weddings right now, maybe not have these large gatherings, but really there needs to be top-down guidance. And it's that lack of top-down guidance that leaves the regular citizens quite confused. So I'll leave my comments there, and I'm happy to discuss further.
Just super to hear this comparison between northern Mozambique. Presumably you were with people who had been hit by Hurricane Itai or something like that in the past. Very interesting to hear that compared with Switzerland, and then compared with Iowa. I just want to ask you, in Mozambique, were you finding that people were quite careful because they've experienced other diseases, perhaps malaria and so on, so it's not an unusual thing for them? Whereas in Iowa, it's more difficult because people are not used to infectious diseases now. Is that a reasonable statement, or do you think there are other factors that are responsible for the difference?
I think that there are other factors. For example, in northern Mozambique, the people were seeing and very frightened by what happened in Italy. And that was really the time that I was there, that I was on the ground observing. So they were like, wow, this is a disease that at first they thought it was a disease that was only going to hit kind of Europe. And that was the perspective on the ground. But then as time went on and the infections began to spread, there was a lot of fear. And I think that people are used to taking measures, to sleep under a mosquito net, or to take different measures to avoid bad diseases in that part of the world. So maybe that is, and then I think also maybe a lack of trust in the hospital system could also be a factor. Like, if I do get sick, I don't really have anywhere to turn to.
Got it. Thank you very much indeed. We were actually just talking to the people from the World Food Prize Foundation in Iowa just recently, and we'll be talking to them again in a few days' time. I don't know whether you're in Des Moines, but a place that's close to the center of my heart. I'm very glad to be in contact with you there. I hope it all goes well. Please stay connected. To Kathy Matthews, lovely to be with you again, Kathy. Tell us where you are, and would you like to introduce your question, but introduce it more as a comment? What do you see happening around the world from your perspective? Kathy. That was meant to be a lovely segue to Kathy Matthews, but I might have lost you. Sometimes this happens on Zooming. You got teed up. It's like being a disc jockey and you think you got the next record ready and you found that you'd actually not put the needle on the start of the record. Okay, I can't see you, Kathy. NK Sethi, you and I have quite a lot of conversations about what's happening in India, and you've been doing some fabulous analyses. Would you like to just give us your take on where things are right now? I'll ask you to be as brief as you can. NK, you have the floor. Click.
Thank you, David. Well, I'd like to comment on two things which have been mentioned in this particular session. That is trust between people and the government and the scientists, and keeping a balance. Now, what I have observed, that in case it's mentioned that our positivity rate is lower, and what we say that our fatality is lower and our recovery is better, don't worry about the cases, we have enough beds, that's an indication which makes the people complacent. But on the contrary, if it is only mentioned that active cases are increasing and we need to be careful about mortality, which is showing an upward trend, and so on and so forth, that makes people scared. So my take is that whenever any official or politician makes a statement, they present a picture whereby they say, yes, where we are doing better, maybe our mortality is lower, but at the same time, our case rate increase is faster than anywhere else. And for that, we need people to participate, and then so on and so forth, what they need to do. So that's how the trust will get built. Otherwise, if the scientists say something and the government says something, there's a distrust. That is one. The second aspect which was pointed out in this particular, has been pointed out, is that we need to adopt a middle path. Yes, absolutely essential that we need to adopt a middle path, which is a balanced way. But at times what we see that the health systems gets overwhelmed and is not able to take care of either COVID care or non-COVID care together. So then maybe the third way would be that's area-specific local sector restrictions based on the local capacity of the health system, and some criteria may have to be evolved, which is locally relevant. Maybe it's a case rate increase of greater than 2 or 3%, mortality of more than, recent mortality of more than 2%, or positivity rate above 5, 6, 7, 8, 10%. So that is how we may have to choose a third path, but then this third path is not the path which needs to be adopted, only under certain special circumstances.
Yeah.
I'll stop here, but in case there is something else I need to clarify, I can do that.
Please do. Could I just say that what NK has just articulated with a particular focus on South Asia, and he's looking right across India as well as taking data from Bangladesh and Nepal for his work, is really, really interesting to me. You have overarching strategic principles, but then you adapt them to the local realities based on a number of key indicators, like percentage of tests that are positive, like attendance at hospitals, occupation of hospitals, and like the overarching capacity of, for example, testing and tracing. If you don't have that second group of indicators on response capacity, then it's very hard of just dealing with case numbers. There are some countries where spikes in case numbers are okay because the countries can deal with them by limiting transmission and suppressing outbreaks. There are other countries where rising case numbers is a real source of concern because the in-country capacity is limited. And I would like very much to commend the approach that Dr. Sethi has just given us, because it very much links with what I've told you, Dale Fisher, who works in Singapore and is dealing with the Singapore response, what he's been saying, which is please don't just use case numbers to make judgments about what's happening. Use a basket of indicators, including some of the ones that NK has just announced. And in fact, what Dale and others have been saying, they've been saying there's 7 indicators. I'll ask Catherine if it's easy, or anybody else who can, just to put the reference to the Lancet paper that Dale Fisher and others wrote, because we think this is important. And we've been talking about this with different groups in the UK, with groups in Canada, with groups in other parts of Europe as well, just to say, try to get more sophisticated with the measurement. Don't just use case numbers. You need performance indicators. NK, brilliant. And thank you to everybody in India. You know, it's a big, big challenge, but don't get totally deceived by the Indian numbers. They look a bit astronomical, but remember, India is a huge country of 1.3 plus billion people. So it's not surprising their numbers are quite high. And the more I talk to people working on COVID in India, the more I hear of incredible ingenuity in some settings, not in all. It's very patchy, but there are some beautiful examples. Same in Nepal, same in Bangladesh, same in Pakistan. Now, with Yusuf Gottlieb, what we've been doing in a couple of exchanges is talking about Israel and the issues in Israel. It's really acute in the Israeli situation right now because the country is tiny and people move around a lot. And so, as I understand it, the government decided to go for a nationwide movement restriction to try to deal with the new spikes that are coming along. And what you've done, Yusuf, is you've said, well, that's okay, but it's not good enough. You know, you just can't do it with government restrictions. Give us your analysis of what has been working in different parts of Israel from your perspective. Yusuf, you have the floor.
Thank you, David. I think that there's several issues that I'm trying to understand, and something that seems inextricable to me is trust and hope. They're dependent on each other. And the authorities here lost a great deal of credibility in coming out of the first wave where we did quite well. Now we're in a very, very resurgent second wave that is already overwhelming certain hospitals. And the authorities decided too late to implement a differential approach. In other words, applying tougher restrictions to areas of greater infectiousness, where the infectious rates are higher. That was viewed as discriminatory and prejudicial. So then the government, in order to overcome that, about a week and a half ago said, we are going to declare a breathing but total shutdown. Now, breathing means that a significant part of workers can go to work. But other than that, no social gatherings, no leaving your home for more than 500 meters, and only for essential functions. We are struggling with that. We are struggling with that very much because of the loss of credibility of the authorities, because of the enduring sense that the whole country is suffering basically because two particular groups, one religious and one ethnic, haven't been complying with restrictions. But something I think that is vital for all of us to remember is that the 4 pillars of frontline defense, as you've identified them, David, masking, social distance, etc., should really be above the disputes and the debates about differential policies, lockdowns, partial lockdowns, or whatever. Those should be universal. That is just basic good practices. And I think we need to concentrate on that and get it above the debate just to make sure that line of defense is in place. Thank you.
Thank you very much indeed, Yusuf. What's fascinating about the Israel story is that you've got certain religious groups and certain ethnic groups being quite seriously stigmatized across the nation because they're being accused of not behaving responsibly and being the vectors for the virus. Actually, that's not just in Israel, Yusuf, it's in a few other countries as well. And this is a real challenge. On the one hand, you want to try to get more precision about where the virus is. On the other hand, that can lead to some stigmatization. Thank you for saying there are some essential precautions that everybody's got to do. And this is where Leah Mary's point is a bit disturbing when she says there are whole communities that won't mask because it's not considered manly or it's not considered appropriate for your political party. That's where we get trouble. So we're going to have to work on this, and Yusuf, we're going to have to work on making certain that the universal precautions are truly universal. It's kind of my crusade. Is, you know, I want masking to be done everywhere by everyone, regardless of religion, regardless of race, regardless of any other defining attribute, because unless we can make this a total thing and an absolute thing, it gets very, very difficult. Just one other thing on trust. Several of you talked about trust. Many of you are concerned about trust. Many of you are concerned about the erosion of trust, whether it's vaccines, whether it's dealing with COVID, or whether it's dealing with other tricky issues. Now, Karen Wiedemeyer, some of you will have seen Karen's comment in the chat. What's interesting about Karen is that she's taking a bit of a longitudinal view. She wants to compare what happened in March 2020 and what's happening in September 2020, a bit along the lines of Sarah Bosley. Karen, tell us where you are and tell us the basis for your observation that you're about to give us now. You have the floor.
Okay, thank you very much, David. This is really just a personal observation, you know, this really big difference between what happened in the community in March and now in September. And I think in March, nobody knew about this virus, and the community, the people were really looking up to some guidance and the trust in leadership as well, because nobody knew this virus and the epidemiology of the virus. And I'm talking here from Switzerland. Yeah. There was really like a common standing together, like a common front, you know, everybody was scared and listened to those who knew a little bit about this virus. And now in September, there's so many people who have become experts of this pandemic. You read papers in popular magazines, you read papers, evidence-based studies in you know, high impact journals and so on. So there's so much knowledge now, but it's all little pieces of evidence. It's still not a full picture. And I have a feeling there's also become now a lot of infighting between academics and who is right, who is the best, who knows the answer, and which is really sad, because that, as you said, there's erosion of trust in those who should, you know, provide guidance. And then of course it has become very political as well, you know, depending on your political party, you have a certain stance on the situation and what you do. I think one sentence I once heard and that resonates in me is that we have a common responsibility, but it has to be differentiated. Yeah. You know, it's a little bit my observation that yeah, particularly the erosion of trust into the authorities has really.
Good. Thank you. I mean, not good that trust is eroded, but good that we've made this observation. You know, right at the centre of this, trust and respect for people is absolutely key. You can't do any public health work unless you have that. People are never the objects. You want to move to the point where people do, well, what we hope they will do of their own volition, because they actually want to do it. And that's the case on every single issue I've ever dealt with in public health. We're running out of time. Just Jonathan Fluxman, one sentence from you, please. Love it when you write your comments in. Come in.
Thanks very much, David, and thank you again for organising these wonderful briefings. To me, they're an example of exactly what we need to do when experts make themselves available to ordinary people. Like we have the benefit of independent SAGE here in Britain. It really, really works. And I think if we combine this with local authorities making themselves available and open, say with weekly briefings of numbers of cases, how the containment measures are working and so on. And if here in Britain, say the directors of public health make themselves available and the people feel involved. I mean, a good example perhaps is the way Extinction Rebellion, the climate movement has come up with this People's Assembly idea, which I think is a wonderful way of incorporating ordinary people into vital processes, vital for our survival in the future. I think if we model something on like that for COVID-19, we'd go a long way forward, as long as it's given some standing by local and indeed national authorities. But I think making responses local is very, very important. Thank you.
I was talking to the Chief Executive of Leeds City Council, a lovely, very sharp person, together with, the Chairman of the Council, together with the Chief Executive, and goodness me, once these politicians actually connect with people, such brilliant stuff can happen. Jonathan, thank you. I did want to ask Catherine Deland, one of our team, to just pick up on something we said right at the beginning. I was saying that there's really stark poverty happening as a result of COVID all over the world. I was saying that I'm hearing of people who are actually having to sell their children because of poverty. Catherine, you have the floor now. My senior health advisor, do you want to comment on this and give your perspective on it?
Sure.
You have to unmute. Oh yeah, you are unmuted.
Nope, I am unmuted. Yeah. I think the reason that David is asking me to speak is that I have kind of a story in my family. My father's family was a Dust Bowl era, very poor farming family in the 1930s, and couldn't afford the 6 children that they had. And so my oldest aunt ended up, there was definitely a financial transaction, but moving in with a neighbor, more wealthy family who were childless and really would like to have had a child. And the reason I mentioned it to David is because I think these stories repeat over time. There are ways that people manage poverty, and there are ways that people approach it. And sometimes things that feel quite shocking now are old, and maybe we can also learn from what happened then. I'm not saying we should be selling our children.
No.
But what I'm saying instead is that I think there's lessons to be learned, and stories repeat, and poverty is not new. And people have been managing it for a long time, and I'm not surprised that they're finding themselves in that situation again here.
Catherine, thank you. Just to anybody who wants to test that thing of poverty is not new, there's a book by a lady called Maud Pember Reeves called Round About £1 a Week. If you ever get a chance to just even get that out of the library or look it off Kindle or something, just have a look. As you say, it was just making that point. When Catherine was talking about selling children, I saw Zara have a little chuckle, and you're tiny on my thing, but I can see you laugh even when you're tiny. Zara, it's lovely that you've joined us. Thank you again. I'd just like to invite Twee to just give us the feedback on the survey, to introduce Chris, who we're so pleased to have with us, and to give any other reflection. I'm sorry these are so short because I know everybody would like to talk, but we will have to close in just a second. Twee, please.
So thank you, David. I'm going to spotlight Chris's illustration while I share the results. So the poll results, we have most people coming from Europe, and great to see the number of people joining from North and South America. We have, again, a great spread across the age range with 6 under 30 today. And then how we're feeling, again, optimism is the one people most responded to, and to see a couple of people on overwhelmed, doubtful, or that lowest level of emotion. So just to say, well, thank you for sharing. It is anonymous, so we won't know who you are, but yeah, do talk about how you're feeling. And I'll say we do have the private LinkedIn community chat group going, and I invite you all to share how you're thinking, how you're feeling there as well, because we are, like David said in the beginning, a community, and we're here to support each other.
Thank you very much, Twee. If it wasn't for Twee's constant focus on how we connect, we probably wouldn't connect. We, in our little 4SD family, believe that connection is the key. And that's why those of you who've got things that you're writing, ideas that you're developing, don't hesitate to share them. It's really, really important. Chris, thank you for what you've done. Chris, anything you'd like to say about what you picked up after joining?
I'm really sad I missed the beginning because I came in at a really interesting point. My big takeaway from the news in the UK today is Boris Johnson saying that these restrictions are going to last for 6 months, because, you know, as I work in the events industry, it's been completely and utterly annihilated by COVID around the world. It's good in a way to see a national leader acknowledge that this is a long-term thing. And I think that was actually, for me, the big takeaway from that speech in Parliament. Anyway, it's great to be here as always.
Thank you, but what a good thing that is that a Boris Johnson picture you've got coming in the bottom right under the D of David, or is it something else?
Yes, it's coming up.
Brilliant. Thank you very much indeed, Chris. And as always, everybody, I think we're super, super blessed by the fact that we've got the live illustrations coming. To all of you, thank you for joining. For me, just to reassure you, I am so benefiting from these sessions. The way in which I do my work is by sharing experiences from around the world, and by all of you being able to share experiences on the chat or verbally, or also through sometimes sending emails after the sessions over the weekends and so on. You are certainly enriching me. I'm in turn trying to share in whatever journalist interactions or webinar interactions I have. And this is because I remain totally committed to helping the emergence of the new style of leadership that I believe is going to be the right leadership to help this world emerge from existential crises. Of course, this applies particularly to Zara and people of her generation, because they are the leaders of the future. And I hope that what we're doing as well is giving them ideas and space, basically so that as they move up and into new roles in life, they can do better than we have. Everybody, thank you. On behalf of all of us in 4SD, thank you. And particularly, thank you to those who've spoken, because really, it's the fact that you've got the bottle to talk about things that makes these interactions so lively, and you don't feel as though it's an hour going past. It certainly doesn't feel like it's a stretch of time. Instead, it feels like it's fun. Thank you. Bye-bye.